We're going to hear from a number of people, and there will be time for questions at the end, so if you'll hold your questions, we'll have a roving microphone. Dr. Richard Carmona, United States Surgeon General, was nominated on March of 26 by the President to serve as the Surgeon General and tasked with speaking out on a number of issues. One of them was substance abuse. He was confirmed in August of this year, has been on the job a mere 6 weeks, and he is already taking his task to heart and speaking out on substance abuse. We are delighted to have him here with us today. Dr. Carmona.
Thank you. It's really a pleasure to be here, a privilege to be among my peers and to address this very important issue. One of the jobs of the Surgeon General is really to be the people's doctor, to bring forth good science and articulate it in a manner that the public can understand, because often it's very difficult. And in issues such as this, sometimes it's hard to figure out what the good science is and how it should be applied. And I see that as one of my roles that the President and my boss, Secretary Thompson, have charged me with on a number of issues, including this one. So I'd like to just make some brief remarks as it relates to the issue before us. Marijuana is a serious drug problem in the United States. Continued use is affecting the minds of our nation's youth and can distort their priorities that they have for their lives and their future. Of all teenagers in drug treatment programs, more than half have a primary marijuana diagnosis. More teens are using marijuana at earlier ages. We really need to stop these trends. As parents, leaders, and community members, we need to face this problem head-on and teach our youth that marijuana is dangerous and addictive. I really am very proud of the stand that our President and our Secretary Thompson, Mr. Walters, the Director, have taken in this important message to our parents and kids. The President has put together a formidable team to address these issues. We need to use all the tools at our disposal as a nation to rid illicit drug use from our streets and schools. There's a myth that marijuana smoking isn't as dangerous as cigarette smoking. That just isn't true. Anytime you ingest something into your lungs, generally it's not good for you. This is another one of those things that are ingested that can cause problems. In fact, marijuana contains 3 to 5 times more tar and carbon monoxide than comparable amounts of tobacco. Marijuana now accounts for a significant increase in emergency room visits, up 176% since 1994, which surpasses heroin emergency care in emergency departments. Smoking marijuana leads to documented changes in the brain similar to that has been demonstrated in cocaine and heroin. So there is a correlation with the good science here. People have studied it. They've looked at the brain. They've used MRI, CTs, other mechanisms, and are able to demonstrate that there are changes that are harmful. Marijuana makes it harder for users to concentrate on tasks and projects and can lead to depression and thoughts of suicide. Marijuana is addictive. It's stronger and more addictive than it was 30 years ago. Of those who try it at least once, about 1 in 10 become dependent on it, and right now there are more young people in treatment for marijuana dependency than for alcohol and all other drugs combined. Marijuana is not a rite of passage, but a dangerous behavior that could have serious health consequences. Parents must realize what they tell their children about drug use makes a difference. They must actively engage in educating their children and helping them to make healthy decisions. This is an effort in which every American plays a role. The partnership that we are trying to create, the team that I am a small part of here, really looks to bring all of us a groundswell nationally to address this issue, because we all are the caretakers of our children. We need to accept responsibility for their health, for their safety, for their well-being, and we all play a part in making sure our children stay safe. This is one of many issues before us where we need to step up, put that team together, and make sure that our children get good information. It starts with the parents, the teachers, all of you, and the media as part of that team to make sure that the right message gets out, because there's good science behind what I'm saying. Thank you for the opportunity.